Good evening, good afternoon, and good morning. For all those I'm talking to in different parts of the world, I wanted to welcome you to another program of Saving Grandma. Today we're going to be talking about the secrets to preventing the flu and the cold and COVID. Right now we're in the flu season and the cold season, and there's some basic things that I've learned that I wanted to share with everyone that we've actually been practicing for over 30 years. We use it in our training when we're training caregivers and CNAs, and they're just basic things that people can do at home that are very, very helpful. The reason this whole topic came up and the reason I'm sharing this right now is I got a call from my daughter near Chicago, and a couple days ago she called and said, "Oh, Dad, they're shutting down some of the schools. There's a flu bug going around." And then the next day she called and said, "Well, my daughter has caught the flu." And then talked to her yesterday, and she said the whole family has the flu. We've all come down with it. I am so sick, Dad. And so what I wanted to do is share some things that I've learned over the years that it doesn't work 100% because there are just so many ways of catching some of these viruses and these bugs and different things that are going around, but it certainly helps immensely. So first of all, I wanted to start with masks. Masks have always been interesting to me. When going through COVID, we had mask requirements, and there's different masks, and some work and some don't. And sometimes I see people that are using masks that I'm wondering, why in the heck are they using a mask? I will never forget, I pulled up to an Arby's during COVID when it was required that everybody have a mask in public, and this young lady come to the window, and she had basically this chain mask, looked like a Arabian princess of some sort, and it had all these little beads on the mask, but you could throw a basketball through the chains, and it had no preventive value whatsoever. And it just cracked me up that I guess she was fulfilling the letter, I don't know, the spirit of the law, the letter of the law, I don't know what she was fulfilling, but she was certainly wearing a mask. She certainly, if she had COVID, was spreading it with everybody that was coming into Arby's for sure. So there are masks, and you need to be careful. I always thought it was entertaining during COVID. I did quite a bit of flying to different states, and at that time it was required to get on an airplane, you had to have a mask, which was fine. I didn't have a problem wearing a mask. What I thought was hilarious, though, is we'd all get on with our little mask, and some had decorative masks, and everybody had their different masks. And you get on the plane, you take off, and then about 15 minutes in the flight, you hear the announcement that they're passing out water and drinks and cookies. And so everybody takes off their mask and starts eating for 10 minutes, and then you put your mask back on. Now, in a small environment like an airplane, I'm thinking, oh yeah, if somebody's got COVID, we're going to share it. I mean, the statistics show that when you cough, that little COVID virus will go anywhere from 6 to 11 feet, which basically half the plane is contaminated with COVID if somebody coughs without their mask on. Now, there are some tests, and you can tell if it's a good mask or a bad mask. A lot of them have kind of a double protector on them, and you can just see through the fabric. This is not woven, and the test is very simple, and they actually have this on some of the Google channels. You take a candle, you light that candle, you put your mask on, and then you try and blow out that candle. Now, I've done it, and there are masks. This is a very good mask. I can't blow out the candle with this mask, no matter how hard I try. Now, the funny thing is, and it's very interesting, is this is a KN95. It was always interesting during COVID when we were in healthcare that you couldn't get an N95, so you get a KN95. Good mask, but a KN95 comes from China. 80% of all the protective equipment came from China during the COVID. So they shared the virus with us, and then they also turned around and charged us for all the protective equipment. But it's a good mask. It's got the double liner in it. You put this on, you try and blow out the candle, and there's no way you can blow out the candle with an N95 or a KN95. Now, the hard thing is there were people that were using bandanas and different things they thinking they're giving this big protection. Plus, they look really cool if you're wearing a bandana. Well, if you look, you can see through these, the light that shows through these. I mean, they've got gaps that you could throw a basketball through, and very easily, when you put this over your face, over your nose, you can blow out a candle in 2 seconds. So one simple way, it's not totally scientific, but it's a simple way to see if you have a halfway decent mask, is to test and see if you can blow out a candle with it. If you can blow out a candle, then you know that your mask is receiving germs and you're kicking out germs. So if you're trying to do the world a favor because you're not feeling good and you've got a cold or you got the flu and you're wearing a terrible mask, you're still sharing it with everybody. So make sure you've got a decent mask that at least you can't blow out the candle, because then you're not transmitting germs back and forth. Now, the other thing that I always thought was hilarious during COVID was that people would wear their mask inappropriately. And so I would see people that would have it over their mouth but not have it over their nose. And I would look and think, okay, that ain't doing any good. But in their mind, there again, they were told to wear a mask, so they're going to wear a mask. They weren't told how to wear a mask. And so they were doing nobody any favors. They were still passing germs and receiving germs because they wore their mask inappropriately. So a lot of these pointers that I'm giving are for you individuals at home, especially you mothers that have little kids. Little kids just are, it's so hard when you have little kids and they just love germs. So be careful on your masks. The other thing that I think is very interesting, and I've seen this, in fact, I have to share another story. During COVID, the essential workers, we still had to go to work. We're in healthcare and we're taking care of sick people. So I'm driving down the highway going to work one day, and I see this individual driving past me, the only person in the car, and they have their mask on. And I look over, I'm thinking, oh, interesting. I wonder if they're afraid they're going to give COVID to somebody in the car or receive COVID from an empty car. There wasn't a lot of common sense and probably not a lot of information given from on a public service as far as how to wear a mask, when to use a mask. And the other part of that is, which I'll go into right now, is the fact that we have a tendency to touch, even with a mask. They've done some studies, and the study was basically how often does a person touch their face in an hour. And they measured what they call the mucus areas, which they call the T area, your eyes, your nose, and your mouth. If you were to guess, if this was a trivia question, how often do you think the average person touches their face on the T area, the eyes, nose, or mouth, in an hour? Well, here's the answer. And hold on, buckle up, because it will shock you. It's over 50 times an hour that a person touches their face. And it's, anything from little twitches, scratches, to, your nose, to touching your mouth. The average person touches the T area 50 times an hour. Now, here you're being so diligent, you've got your mask on, and you think you're safe. And then you touch in the T area, or you scratch your nose, or you scratch your mouth. Even wearing a mask, you then transfer every germ, because we know that these viruses, a lot of them transfer through mucus. Where are the mucus? Nose, eyes, mouth. 50 times an hour you're touching. That mask has done zero good at that point, because you then touch those areas, and then you go and touch surfaces, you touch people, you handshake with people, you pat people on the back, and all of those germs that you're transmitting are transmitted to other people. Not a good thing. The other thing is, and I think it's quite interesting, is I see a lot of people wearing protective gloves. Not a bad thing. Not a bad thing at all. However, when we are instructing healthcare workers, caregivers, when they go through to get their license, some of the first things that they learn is change the gloves, wash your hands consistently, change your gloves after every duty that you've done. Most people, I've seen them going to the store, going to all these different places, and they're wearing their protective glove, which is fine, except they're going around and touching dirty surfaces, which is no different than touching it with a bare hand. They're spreading germs through the glove to everybody and their dog. Now, I wanted to share some things because now I wanted to give you a few secrets. In healthcare, they've been training for years and years on universal precautions. Back 30 years ago when I started in the business, there was this huge fear when HIV and AIDS started to become prominent and there was awareness. Healthcare individuals were scared to death. Oh no, I don't want to catch HIV and it's very contagious. What do we do? Well, through the studies and through the years, we figured out very simple, universal precautions. Wash your hands. Wash your hands consistently. So in healthcare, you'll see sinks just about in every room, outside of rooms. They're very prevalent so that individual caregivers can wash their hands after every task. Now, I was reading this and I think it's quite interesting because the one thing we don't do really well, and what I'm trying to communicate, is in your home. In my daughter's home, where right now flu is spread through the whole household, what do we do? Well, it says here that by proper hand washing, and that's what we need to do, is teach ourselves and our children what proper hand washing is. Pinterest has some really cool things. You look under hand washing and it has some little posters that show how little kids how to properly wash your hands. It's always been kind of the industry standard that you wet your hands, you put soap, and then you lather your hands, and you basically need to do it for at least 20 seconds. Well, nobody sits there and times themselves, so then it was, well, sing happy birthday to yourself, and that takes 20 seconds. And then you try and get all parts of your hand and scrub it in, and then you rinse off. But our little kids don't know that. Most of our family members don't know that. This is actually, by proper hand washing, we can cut down, reduce people who get sick with diarrhea and other ailments by 23 to 40% just by proper hand washing. So there you've cut down 23 to 40%. If you and your family practice good hand washing techniques, you would cut down 23 to 40% on your chances of getting sick. Now, it's interesting, respiratory illnesses like colds, COVID, in the general population, you can cut colds and COVID down by 16 to 21% by proper hand washing. Somebody who has stomach illnesses, they can reduce absenteeism in school children by 29 to 57% by proper hand washing. That's amazing statistics. And so one of the basic techniques, and that's universal precautions, that's one of the key items that they use in hospitals and institutes and in doctor's offices and dentist office. It always goes to universal precautions. Wash your hands. You touch something, wash your hands. You change tasks, wash your hands. You'll see protective devices like these gloves, latex gloves or different types of gloves that they make. They're good, but they don't do any good unless you change your gloves, wash your hands every time you touch something, because this glove is a carrier of germs just like this hand is a carrier of germs. So you got to consistently be changing or consistently be washing. Extremely important. Now, let's just talk a little bit about germs themselves. A germ has a long lifespan. And so you kind of wonder, okay, long lifespan, what's a long lifespan for a germ? Well, this was a study done on COVID, and a lot of the germs are very similar, cold and flu. If a germ lands on a copper, on a metal that's made out of copper, it will live 4 hours. Not that long, but 4 hours is 4 hours. Cardboard, the germ will live approximately 24 hours. Then you go to stainless steel, look at your refrigerators, your appliances, a lot of handles, a lot of doorknobs. A germ will live 40 hours. Then you go to plastic. There's a lot of things made out of plastic these days. A germ will live 70 hours. So then it's It's kind of like me. Let's just say I go to Walmart and I shop there. I shop all these different stores. I'll go to use the restroom and I'll see somebody who uses improper hand washing techniques, which is probably 80-90% of the people. They basically just dip their hand for 2 seconds. You don't even, I say wash your hands and sing happy birthday, get them lathered for 20 seconds. Well, you don't even get happy out of your mouth. They basically got soap or water and they walked out. Well, then they go out and they touch all these different things at the store. You know, all these things that are cardboard, half the things are wrapped in cardboard. Well, we know that the germ's going to last 24 hours on cardboard. Plastic, half the stuff is wrapped in plastic. 70 hours. So here these people go out of the bathroom, they haven't washed their hands properly, and they're touching all these items at the store. You go by and you look at an item because you're interested, you want to know the price. Automatically, you've picked up germs. Why is it when you go to stores now, they offer these little Clorox wipes to wipe down the handles of a cart, a shopping cart? Because germs hang out on those metal surfaces for hours. So we know that it's stainless steel for 40 hours. So just because somebody hasn't used the cart in a while, that germ will live for 40 hours. So there are things that you need to be aware of, and you need to be constantly aware that, number one, people are not properly washing their hands, and number two, we as average human beings are constantly rubbing or touching or rubbing our nose or our mouth or our eyes, whether we're wearing a mask, no matter what we're doing. So, for example, we go to Walmart, we pick up a couple things that we look at a couple things, we then rub our eye itches or our nose scratches. We could be wearing a mask. We still reach up under and touch. Automatically that germ is going directly to the body. So welcome to the sick world. You've just caught the flu, you've just caught the cold because you didn't use proper hand washing and because you're touching your eyes, nose, and mouth constantly. One of the things that you can do at home that we've done for years and years in institutes, in healthcare institutes, and a lot of people don't know it's very inexpensive to do and very, very effective, and that is mixing Clorox with water. It should be 10-1, the ratio, and 10 parts water to 1 part Clorox. But Clorox, man, I mean, we're fighting in institutes, you're fighting a lot of contagious bacteria and viruses, from C. diff to all these flu, I mean, you name it. And the only way we can fight it is by having proper cleaning techniques. And you can do this in your home too. So you mix up 10-1 ratio of Clorox and water. And during the COVID, we were going through our entire facilities and washing everything down, wiping everything down 4 times a day. And you think about it, I mean, you got germs on doorknobs that are living 40 hours. On anything plastic, a counter, anywhere from 40 to 70 hours. So you've got these germs that are alive on surfaces. The only way you can get rid of them is just get a bucket of Clorox with this 10-1 ratio and wipe things down, and it will clean those germs. Very important, very easy to do. You look at the number of people that go in and out of your home. Your kids just get back from school. They haven't washed their hands. They grab the doorknob, open the door, they go to the refrigerator, touch the refrigerator. All of those areas, and you can almost see their little fingerprints as they go through, need to be wiped down and cleaned with Clorox. That will prevent these little viruses. It will prevent flu and cold and COVID from spreading throughout the house. Not 100%, because these viruses are tricky. But it will certainly prevent a lot, because most of the time you kind of assume you're in a protected environment because you're at home. No, you got a lot of people going in and out of your home, and they're picking up these wonderful you go shopping and you go do these things. Well, you've picked up all these little viruses, and you need you need to be sharing these, or you need to be cleaning these, and know that people are sharing viruses with everybody. I mean, your friends and your neighbors and people you don't know, everybody's sharing. Sharing is usually a good thing, but not when it comes to the cold, the flu, or COVID. Excuse me. So I wanted to share these things with you because to me it's important. I mean, just basic precautions. They call them universal precautions. Just basic. I mean, you wouldn't think hand washing would be so important, but it's vital in the healthcare industry. It has saved a lot of lives and it's killed a lot of people by not following universal precautions. Uh, Doing that added washing your hands is so, I mean, of all the things, hand washing is so vital and so important. And to do it properly for that 20 seconds, it is just so important that you do that. So take the time, look up on Google, order you some little things that you can hang up by your mirrors that have little pictures that show your kids how to properly hand wash. Teach your children to wash their hands at home, at school, wherever they're at. Teach them the really good habits by good habits, and then you can teach kids. Try to remember not to touch the T area, eyes, nose, and mouth. And if you do, wash your hands. Those are very important. And then to realize that you're not totally protected by wearing gloves and by wearing a mask because you're still touching. Anyway, I wanted to share that with you. I thought it was important, and especially during this cold and flu season. I've got grandkids that are sick, and I try and share these things, but I know how busy moms get, especially when kids get sick. It doubles their workload. So try and do the basics. See, there I am. I'm looking at my camera, and there I am, just automatically touching my eye, touching my nose. I just automatically have a habit of doing that, and just that awareness. I got to go wash my hands. Now, I always in my podcast try and tell a grandpa joke. I usually tell it at the first, but I saved it for at the end of the podcast. So the grandpa joke for the day is that grandma and grandpa went to church. Well, the grandpa had gas, and he actually let off some gas in the middle of church with all these people sitting around, and he leaned over to his wife and he said, "I have gas, but it was silent. What do I do?" And the wife leaned over to him and said, "You need to change the batteries in your hearing aids." Anyway, that's my grandpa joke. Stay healthy. We lost a lot of grandma and grandpas during COVID. Flu and cold and these things can be devastating to elderly people. So stay safe, follow universal precautions, and just do the basic. It's not very expensive to wash your hands, not very expensive to put a little dab of Clorox in water, and just keep your environment clean. You have a good day.